Do you know? Severe acute respiratory syndrome coronavirus 2, better known as the coronavirus, is a new type of coronavirus that is transmitted to humans. This virus can attack anyone, such as the elderly, adults, children, and babies, including pregnant women and nursing mothers. Coronavirus infection is called COVID-19 and was first discovered in the city of Wuhan, China at the end of December 2019. This virus is spreading very quickly and has spread to almost all countries, including Indonesia, in just a few months. Coronavirus is a collection of viruses that can infect the respiratory system. In most cases, this virus causes only minor respiratory infections, such as the flu. However, this virus can also cause severe respiratory infections, such as lung infections or pneumonia. This virus can transmit through sputum droplets from the respiratory tract. For example, when in a crowded classroom with poor air circulation or direct contact with droplets. And now, there is Sinovac vaccine in Indonesia. Let's see the explanations. Check it out. Assalamualaikum warahmatullahi wabarakatuh. Hey there, my name is Zikra, and this time I will explain a little about a science article entitled Get to Know the Sinovac Vaccine That Has Arrived in Indonesia. Check it out, guys. The first is name and manufacturer of Sinovac vaccine. This vaccine is called CoronaVac and is produced by the biotechnology company from China based in Beijing, Sinovac Biotech. This company is focused on research, development, manufacture, and commercialization of vaccines to prevent human disease transmission. Okay guys, the next is way of Sinovac vaccine to work. Through clinical trials that have been conducted in a number of countries, CoronaVac, which is made from the inactive SARS-CoV-2 virus, works by triggering a rapid immune response. However, the antibodies produced by this vaccine in the body are not more than the antibodies that have been successful formed in people who have recovered from COVID-19. Although not that much, the antibodies produced by vaccination using the vaccine are said to be sufficient based on preclinical studies conducted on monkeys. Okay guys, the next is side effects of Sinovac vaccine. The vaccine can be said to be safe because there are no adverse things happening to the volunteers who received the vaccination. Side effects were found but were small and mild in some of the volunteers. The side effects found were pain the injection site 20 until 25% of volunteers. Guys, the next is ingredients of Sinovac vaccine. Number one is antigen. All vaccine contain active component antigen that act to trigger an immune response or other ingredients designed to make that active component. These antigen are made up of small parts of disease-causing organisms, such as protein or sugar. In addition, antigens can also be made from intact disease-causing organisms, but in weakened form. Two is preservatives. Preservatives are needed so that the vaccine is not easily contaminated once the container is opening if it is to be used for vaccinating more than one person, while vaccine in single-use dose containers usually do not contain preservative. The preservative commonly used from vaccine is to phenoxyethanol. This compound has long been used in various baby products because it is not very toxic to humans. Number three is stabilizer. Stabilizer are compounds used to prevent chemical reaction between components and prevent vaccine from sticking to the container. Commonly used stabilizer range from sugar, amino acid, and protein. is surfactants. Surfactants are compounds that keep the ingredients in the vaccine mix properly, not clumping. This compound is also commonly used to make food such as ice cream. 5 is diluent compound. Sterile water is commonly used in vaccine as a diluent. The goal is that the concentration of ingredients in the vaccine is appropriate before use. One is auxiliary compounds. Some vaccines are made with additional auxiliary compounds such as aluminum phosphate, aluminum hydroxide, or aluminum sulfate in small doses. The goal is that the immune response generated in the body is better. Okay guys, the next is science aspect of biology. Number 1. All vaccines contain active component antigens that act to trigger an immune response or other ingredients designed to make that active component. Number 2. Drug clinical trials that have been conducted in a number of countries, coronavirus, which is made from the interactive SARS-CoV-2 virus, works by triggering a rapid immune response. Last one is science aspect of chemistry. Number 1. Stabilizer or compound used to prevent chemical reaction between components and prevent a vaccine from sticking to the container. And number 2. Some vaccines are made with additional auxiliary compounds such as aluminum phosphate, aluminum hydroxide, or aluminum sulfate in small doses. That's all for me. See you in the next video. Bye bye. Assalamualaikum warahmatullahi wabarakatuh.